This is my friend Sarah. She's going to be my patient today, and I'll be showing how to do an upper body assessment, and that's the consent form that she's signing. Whenever I go to do an assessment, I usually am walking into the patient's room, and I'm just kind of small talking with them, but I'm also assessing while I'm talking with them to see if they're orientated to where they are, if they know who they are. I can also tell from the way they talk if there's anything going on with their speech, and I can tell if they're confused or not, or if they're lethargic, because on the floor I work there's a lot of post-op patients that come back confused, lethargic, or sedated. Then once I kind of talk to them a little while, I usually start working from the head down, so I'll be kind of going from the head to the lungs today. And if I were to assess Sarah's scalp first, or her hair, with some conditions, patients have really brittle hair, or they might have patches where the hair isn't growing anymore. So I would just look for any abnormalities with that. So I could be looking at her hair and her scalp, maybe while I'm giving the patient their bath. And then whenever I'm looking at their face when she's talking, I would be able to see if all the facial muscles are moving correctly. So, like, for example, an abnormality would be if she's talking and one side of her face isn't moving. That's an abnormality. Some further assessment that could be done in her head and her mouth and eyes can be done with a pen light. So whenever I'm talking with Sarah and when I use my pen light to assess her eyes, that kind of will help me decide if I need to perform a focused neuro assessment. But with Sarah, when I go to examine her eyes, her pupils are reactive as they should be, so I know that I probably don't have to do a focus assessment. What I just did is I used the pen light to check to see if they were dilating the way they should be with the light. And then also I usually with my patients, especially if they're neuro patients, I check to see if they're accommodating properly. So I'll tell them to look at me and then look at a TV, and then you should see a change in their pupil size. To continue, the next thing I do, depending on the patient, is I check in their ears. So if it's an adult, I usually have to pull on their ear upwards and kind of towards the back. And then I also use my pen light to just check, and I can see what color their eardrum is from doing that. And I can also tell if they have any buildup of like earwax or anything. And obviously at this time I would know if they wear hearing devices. Then with the patient's nose, I also just use the pen light again. And if I tell them to look up, sometimes you can see if they have excess mucus or kind of like rhinitis or inflammation or anything like that. That would be abnormal because it should just be pink and there shouldn't be excessive mucus in their nose. Then when I'm assessing the patient's mouth, I'm checking their tongue to see if it's dry. I'm checking the color of their mucous membranes. If they're pale, that might be a sign that they're dehydrated or anemic. Basically, I'm just trying to see if there's any symptoms that could be because of a different condition that we would have to further investigate.